Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. If you are a patient with an invisible illness, be it EDS, joint hypermobility, ME, or chronic fatigue syndrome, multiple sclerosis, RA, which can be more invisible than most people think, Lyme disease, dysautonomia, or POTS, well, you get the idea, you likely know the importance of getting your own exam and testing data, right? Now, I am on a mission to help spread the awareness of the importance of not just getting your own data, but the importance of getting the raw data. This means getting a copy of the MRIs, the MRVs, the blood tests, etc., not just the reports, okay? Why is this important, you ask? Well, believe it or not, doctors can make mistakes. Shocking, I know. We are all human, and in the age of insurance forcing us to shorten our time with patients, mistakes can occur or details can be missed. When we are looking at invisible illnesses, especially, even the tiny details can be critical. Now, can I share with you just one of the many examples I have with many types of EDS or joint hypermobility? We need to keep an eye on the size of our aortic roots, right? Because genetic data is still incomplete. Many of us are unsure if we have Marfans syndrome or the mass phenotype, Stickler's, Loeys-Dietz syndrome, emerging Marfan syndrome, familial aortic aneurysms, or one of the currently 6 types of EDS, for example. Now, in our family, we had many of the signs and symptoms of Loeys-Dietz syndrome, which means the aorta can burst at a much smaller size than in the other connective tissue disorders. Until we were tested for that defect, it involves TGF-beta R1 and R2, I knew we needed to be hypervigilant. Also, because we couldn't rule out Marfan syndrome completely, the Ghent criteria is typically used, but it isn't foolproof. Aortic root size is important to us. So we see the pediatric cardiologist for follow-up with my son. She says all is fine. Now, control freak that I am, I get the raw damn data and find out that when I graph his aortic root size, he is not fine at all. To calculate this yourself, you can calculate the body surface area and chart it on a nomogram of normal with a range of probably okay around it. Does that make sense? This is where my son's number was when I graphed it. His measurement was that red dot way above the range of probably normal. Do you see it? Yikes. In a semi-panic, I called the cardiologist. As it turns out, she was using a nomogram that was over 25 years old. Not acceptable, as these change over time. By the way, if you want to chart yours, all you need to do so can be found at marfan.org. Great site. Now, I know of one patient whose doctor made a mistake of 1 centimeter with this measurement. Now, we are watching tiny changes, right? A centimeter is not tiny. He nearly had a heart attack until they discovered the error. So promise me you'll ask for your raw data always? Okay, I feel better. Till next time, my friends, let's continue to change our worlds one brain cell at a time if we have to. Gentle hugs to you all. Bye.